Let's go to the U.S. now. And the governor of New York State, Andrew Cuomo, has been delivering his daily briefing, and the news is distressing. He said that they recorded the highest single-day increase in deaths since the outbreak began. 731 people died.
That is the largest single-day increase. And we talk about numbers, but that's 731 people who we lost. Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother. So a lot of pain, again today, for many New Yorkers, and they're in our thoughts and prayers.
Kristen Lumi joins us now from New York. Kristen, the numbers are still going in the wrong direction in New York.
That's right, certainly in terms of fatalities, although in terms of hospitalizations, while they're still going up, the governor did suggest they may be plateauing, and that is a little bit of good news. He pointed out that in 1918, the Spanish flu epidemic took 6 months to reach its apex, whereas this would be happening in just over a month here in New York and in the surrounding communities, possibly of Connecticut and New Jersey. But he did caution that extreme measures would have to remain in place in order for that to happen in terms of social distancing. And he also pointed out that a resurgence could still be possible if hospitals weren't able to stay on top of the situation as well. There's still concerns about gear for medical workers, beds for patients, and equipment and protective equipment as well. And as well as a number of medical personnel. In terms of beds, there's been some good news in that the U.S. Comfort, which was sent to New York to take overflow hospital patients, is now being used to treat COVID patients and will be able to accept another 500 COVID patients. So that was a step in the right direction towards alleviating that problem anyway.
What did he say about how much longer, what the outlook is, pardon me, Kristen, for the need for social distancing to continue and self-quarantine and things of such?
That's the question that everyone is asking. And he says that it's something that he's working on with the governors of those neighboring states. One thing that will be necessary in order to return to life as somewhat normal, he says, is more testing to find out who's had the disease, who's immune to the disease, and who can safely go back to work. And on that front, New York has approved a new antibody test for use in the state. However, that needs to be scaled up so that it can be given to people on a large basis. He says that that's something that they're working on in order to get things back to normal. But right now, things are closed in New York for at least until the end of April. The measures that were announced in terms of schools being closed and essential businesses, right now, they are effective till at least the end of April.
Kristen, this is taking quite a toll on healthcare workers, physically and mentally. I think it's safe to say this is something that few of them have ever experienced before. What is being done to get them help, to get them reinforcements?
Yeah, that's a real concern because this is really intense what they're dealing with, and the emergency rooms are certainly the front line. Not only doctors and nurses, but EMTs and police officers are getting sick while trying to keep the rest of us safe. So there have been calls for volunteers around the country. Tens of thousands have answered that call. But here in the city, the mayor has warned that they're going to need even more medical personnel in order to keep on top of the situation. I talked to some volunteers who are stepping up recently. Here's what they had to say.